Today I'm going to describe the best of the clinical trials in 2020 in the ECC, the European Society of Cardiology, and the AHA. Actually, this is the best. We have a lot of trials, but this is the best of the best. The best trials, I think, in inclisiran, and this is the new drug using in messenger RNA, and this is the Orion 3 study. So it was found to be potentially and potently durably reduce LDL in this pooled analysis. A second trial in ECC is called COT trial, nowadays using as the anti-inflammatory drug, which is a colchicine, which is a cheap drug. It is a cost-effective if you use the low dose of colchicine after infarction. This is proved in COT trial. Then come to the problem of using antiplatelet anticoagulation in diabetes cardiovascular disease. It was found it's very effective to use this combination, particularly rivaroxaban twice daily, 2.5 milligram. So it is make a revolution on the use of this drug. Vagere, PED for peripheral arterial disease or lower extremity. Also rivaroxaban, apart from COMPASS trial, is very effective in those patients for prevention of cardiovascular disease and LMP events. And this could be in the future the treatment for those patients with peripheral disease. And then the Twilight, which changed the use of DAPT versus monotherapy, which in order to prevent bleeding. You have one trial, is called Twilight. The second is Twilight Complex in diabetes and the complex PCI. In favor nowadays that you give DAPT for 1 month, and then you can follow for ticagrelor for more than 1 year, and then for 90 milligram twice daily, then 60 milligram for 36 months. Ischemia trial is a revolution trial, which is comparing the conservative PCI. It was found it is the same if you use PCI or ischemia in chronic stable disease, and also in these patients with CKD. Then the Victoria trial, we're using a new drug, which is a positive inotropic effect. It's called Vericat. And this Vericat uses those patients with the HFrEF, with heart failure, with reduced ejection fraction. It is proved now it is very effective. So it's starting from the ECC to use a new drug for the myocardial contractility. Then the reduced trial, which is use this exopentic acid levels in reducing the cardiovascular events or cardiovascular outcome if those patients with hypertriglyceridemia. The Odyssey trial, using also a new drug, PCSK9 Elericam, it was safe with homozygous familial hypercholesterolemia. It should be recommended in all these patients. The Paragon heart failure, there's no difference in using sacubitril valsartan on pro-AMP in patients with heart failure, preserved ejection fraction, but it may be effective mid-range and those patients with women. The DAPT heart failure, this is the new SGLT2 inhibitors. DAPT was very effective in reducing the events and the first repeat events in heart failure. That's why at the DAPT is changing now the guideline to use this drug in those patients without diabetes. The Inavel is using NOAC or edoxapan versus warfarin after surgical biprothetic valve implantation or valve repair. This is the first drug to be used in the biprothetic rather than using warfarin in those kind of patients, which was absolutely contraindicated in use NOAC. Then the European Society of Cardiology with the digital experience, which also completely virtual. The most important drug is emperor-reduced drug, empagliflozin, which is SGLT2 inhibitors, also is found to be effective with reduced ejection fraction with or without diabetes. The popular TAVI, it's important for after TAVI use aspirin or aspirin without clopidogrel. There's no difference to use the aspirin or aspirin clopidogrel. So no, doesn't mean nothing to use clopidogrel. The ATPCI, which is a trimetazine, it's used in those patients with chronic stable angina. It's angina pictures with recent successful PCI, which wasn't before, but it was found to be effective in those patients after PCI. The Parallax trial also shows there is no difference if using sacubitril valsartan in those patients with heart failure with preserved ejection, like the Paragon trials. Finally, low DOC trial, low-dose colchicine, like the COLCOT trial. This is the second trial in coronary disease. So we have one in the ECC, the second in European Society of Cardiology. Recently, in AHA 2020, there is a lot of trial to be mentioned in this conference, which is Alpha's trial. Alpha's trial, elective PCI, use ticagrelor versus clopidogrel. There's no difference. 1 month DAP trial, using 1 month versus 6-12 months, there is no difference. Rapid CT, using CT in those patients acute kidney syndrome, intermediate or high risk, there is no difference. Mithras trial, closure of atherogenic ASD after transmitral repair, it wasn't superior to conservative. Even camp efficacy of this camp in those patients with refractory hypercholesterolemia is very effective. Using pill is effective with or without aspirin. This is from Salim Youssef. This is called Polycap study. Samson trial, 3 arms using statins, placebo tablets. For the side effect, there is no difference. And VitaRhythm in atrial fibrillation, 3 trials, important 3 trials. VitaRhythm using omega-3 fatty acid, vitamin D. Actually, there's no importance of this using drugs. The REVERT trial using rivaroxaban, it was non-inferior versus warfarin in those patients with bioprosthetic valve. The VITAL-AF, no importance of screening of those patients going to primary care visits. And in heart failure, there are a lot of trials. One of them is Galcat heart failure, a new drug for systolic heart failure. Is very effective. Affirm trial, intravenous iron is effective. Sugar diabetes is also the empagliflozin and empagliflozin is very effective in diabetic or non-diabetic heart failure. In those patients with left ventricular volume, there is remodeling. Folist heart failure, another drug which is important of sotagliflozin, which is a new SGLT2/1 inhibitor. I think this would be the drug of choice, sotagliflozin. Remember this drug, Solicit heart failure, it's very effective in those patients with diabetes. And Scored and Solis, the same effective in heart failure with CKD. And finally, the omega-3 fatty acid have one called Strength trial, the fish oil, and doesn't reduce risk cardiac events. Omega trial, omega, no help. So there are 3 trials of omega. 1 is called Strength, 1 is omega, no effect, although reduced trial. Although there's another trial called reduced ET, it's very effective. And finally, thank you very much for listening to this trial and looking for the next best trial in 2021.